Hello, Today we're going to talk about how drugs work. So the beginning of the life of a drug is actually getting it into our body. And this can happen in a variety of ways. The one that we think of most commonly is by taking a pill, shown here, or it could be a capsule, of course, or even some kind of liquid. The next way that one might think about is to inhale medication. You probably know children who use an asthma inhaler or some other type of device to deliver a medication into the lungs. Then, of course, everybody has experience with having a medication injected into us, and that can be into a muscle below the skin, or in a more technical and rapid way, delivered intravenously. This typically, of course, is done in clinics or hospitals. And finally, we can put a medication directly on the skin, either in an ointment or a cream, or as shown here, with a patch that will deliver some type of medication. Now for today, we're going to focus mostly on the oral route, but as with all of the others, this is the biggest challenge in the drug's life, or the biggest hurdle to get over, is actually getting into the body. Now as we follow the life of a pill, we'll see that it first has to travel from the mouth back down through the esophagus, which is the tube that connects the mouth or the throat down to the stomach. And you can see it entering now into the stomach. And there it will begin to dissolve. Some of the medication will actually get absorbed in the stomach. Others, or remnants, shown here, will go on into the small intestine where they can finish dissolving and being absorbed. Now in this slide we're illustrating the idea of absorption, and here we use the everyday kitchen sponge. Now in truth, our stomach and intestinal lining don't have holes this big, but the point is that the molecule has to be small enough to get through the holes that are there, or the barrier that's there. And you'll notice here that we've got a red flag. And you'll see through the rest of the presentation, we're going to point out where things can go wrong, or where there are challenges to developing a new medication. So the first way we illustrated here is that the molecule has to be small enough to get through the pores. Now they're not literally pores, but it's got to get through there. Now secondly, in the case of our stomach, it's a very hostile environment. There's a lot of acid there. You've all experienced this when you had heartburn. And many molecules, medications or potential medications, are sensitive to acid. It will destroy them. So for these two reasons, both the size of it and the sensitivity to acid, a lot of things cannot go through this oral route, and a great example is insulin. It's a protein, and it cannot survive this route, and it couldn't get absorbed if it did. Therefore, we have to inject it or deliver it through an inhaler. So this is a common problem, that a medication that we'd like to send through the stomach just can't get there, and we have to devise another route. Now, once the drug is absorbed, if it's absorbed in the stomach or in the gut or the intestine, the medication, the drug, goes directly to the liver. This is because there's a specialized blood flow that goes right to the liver before it can get anyplace else in the body. This is important because there are enzymes in the liver that will destroy some types of molecules, and this is going to be a good thing when we're trying to eliminate the drug from our body, but it can be a problem. You see a red flag here if we're trying to get the medication into the body. So a lot of it may get destroyed before it ever gets past the liver. Ones that do get past there are now distributed. They go throughout the body, carried by the blood everywhere in the body. Now this happens because, obviously, the heart pumps blood everywhere. We're going to talk about one exception toward the end. But all the organs and tissues in the body will be supplied with blood, and of course the medication goes along for the ride. What's the red flag here? Well, the drug may bind to protein molecules or fat molecules, like cholesterol, or either good or bad cholesterol, in the bloodstream, and that makes them less available to get to the tissues or the organs when they need to. So at this point, we're going to consider one of the essential questions in this whole process. Now, how do those drugs know where to go? Are these really smart molecules that they know that they have to go fix your blood pressure or take care of a heart problem? How do they know where to go in the body? Well, the quick answer is they don't. The drug was designed with something in mind. We showed it here as a baseball inside of a mitt. So we threw that baseball directly at that target, if you will. It was designed to do this. So we've gone after typically a protein molecule. It's either on the surface of a cell or it's an enzyme inside a cell that we're trying to alter in some way. For example, to treat blood pressure, we might want to inhibit an enzyme called ACE, or we might want to block a receptor on the lining of blood vessel cells. But this is where the specificity comes in. This is how the drug knows what to do. It's going to hit that target. The drug is going to be everywhere in the body, but the targets are only in certain places. So in a certain sense, we're inefficient. We send the drug everywhere, even though we only want it in certain places. Now the next step is once it's there, and it's a tissue or cell that has the target, the cells take up that medication, or it binds to the cell, and it begins to do its job. So it's not until it binds to that target, either enzyme or the receptor, that it does its work. Now conversely, this is when side effects can pop up because medications can bind to things other than the target. This is particularly true if there are some closely related molecules. Remember early on we talked about why you don't want a medication that stays in your body forever. It'd be nice to have the positive effects forever, but you certainly wouldn't want the side effects forever. So the exciting part now is once the drug has been distributed throughout the body, gets into the cell, and hits the target, this is when good things happen. The reactions between the drug and the target within the cell give us the desired effect. Now, if it's for pain, example, from aspirin, the pain is relieved. If it's a medication trying to stop Alzheimer's, the process is blocked, and we get the intended effect, or called the therapeutic effect, in the cells. Now, I mentioned earlier that the story that we've told so far is how things usually happen, but I'm going to finish with a description of one exception to the rule. And that is the brain is a special situation. Now, a lot of the blood flow in moment to moment goes to the brain, so you'd think that it should be a ready target for delivery of medications. But there's a phenomenon called the blood-brain barrier, and we believe it exists to protect the brain from things outside of our body, such as toxins in our blood or from viruses or bacteria or whatever, that the brain has to have special protection. To be honest, we don't know in detail exactly how it works and exactly why it's there, but we know that it's a major obstacle to getting a medication into the brain. But as we've shown here in the red flag, it's a major problem with many types of medications. It's a separate issue that has to be considered with every medication that's developed. And of course, this is particularly important if the medication is targeted to the brain. For example, a drug to treat Alzheimer's disease, or a drug to treat multiple sclerosis. So anything that happens in the brain and spinal cord has got to get past this barrier. So with that, I hope you've enjoyed this brief trip around the life cycle of a medication, and we'll talk in the future episodes about some of the more specialized ones like localized medications and some of the other routes of delivery.